Oh, hi everyone, it's Eloise here from HR Prime, and I would like to welcome David. Hello, David, and thank you for your time today. It's a pleasure to have you with me. Um, David, I'm looking forward to talking about the services at Mind, what you provide, and the positive impacts this can have in people in general and kind of in the workplace. Would you like to introduce yourself and have give me a little overview of the Mind services and why it's a passion of yours, please?
Yeah, of course, and thanks for letting me come and wax lyrical about mental health. It is Mental Health Awareness Week, so probably the perfect timing for us both to do this. Well, my name's David. If you want my full title, it's Dr. David Solis, Chief Exec of South East and Central Essex Mind, but everyone just calls me David. So that's really good. I run the local Mind charity that covers Southend, Rayleigh, and Chelmsford, and we offer various services. So we offer supported housing. So we offer housing to people who have mental health issues, and actually own our own properties, but we also work with other providers to make sure they're secure and they're safe and they're happy in that space. We also do floating support, which supports people as they've come out of hospital or in the community that again are having issues and trying to make sure that they keep their tenancies so we don't get life doesn't get worse. So we do a lot of that. We have therapy services, which we include the classic face-to-face counselling, online counselling, group support groups, that kind of classic kind of work. And then we have what's called the corporate offer, which includes training, includes counselling for corporate companies, and we do well-being days. So yeah, and then we do projects. So the other area is just project development, project delivery. But at the heart of what the charity is, and my real passion is about actively listening to people. And I think more so than ever, especially this week, we have to listen to people about their mental health experiences, capture their lived experience. But I think as a charity, I think from the top, from the board, for the staff to the volunteers, it's really about that passion to help people. And I think that's an amazing driver. And I'm always, look, I'm the least important person in the charity. I really am. But my team who work face to face with clients every day are pure lifesavers and they're really gifted. And I'm just really honored to lead it.
I love that. I love that. You can see and hear your passion, and I've obviously met you and kind of worked with you recently, and it's hearing the stories and the passion behind what you do and everything Mine provides. I was kind of shocked at how much, even down to housing, I didn't think that was a thing within Mind, and there's so many elements and services you don't realize unless you actually talk to people, and it's really good what you do. David, talk to me about the three core principles of Mind.
Yeah, so my mind, so I joined in September last year, so not been there that long, although it feels like I've been there 100 years already. No, the great thing about it is that I came in to write a new business plan, give it a new direction, and just open it up to more partnerships. So there's three elements to that. First one is the commitment to reduction. So reduce is one of our key words, and that's about reducing the need for people to be on waiting lists, NHS waiting lists. So if you know the health and social care system, so if you were a young person and you wanted to get onto a CAM service, which is the children and adolescent mental health service, you would probably wait about 9 months to get that first interaction. So it's a really long time. And look, you know as well as I do, nobody gets better. Nothing gets better on a waiting list. So one of our real core principles is to reduce that need on that, and that's about offering other services at low cost that we can then do, and we can then help reduce that. So more people get seen within the current system. The next part of that is about prevention. So the second key word is prevent. We want to prevent people even getting on that list if I can, but also prevent things around, suicide. And let's be really honest and have a conversation today that there are people who will wake up today and decide today is the day that they wish to exit life. And there's a bit of me that says, I run a mental health charity. Where are we in this fight? Where are we in this discussion? And where are we on that? So we want to prevent that, but we also want to prevent anyone really getting more stressed, more anxious, and that their condition kind of gets worse because actually they then get even further in the system, which means it's even harder to help them. So prevention's a big thing. And the final thing is a piece of work around promotion, and it's about promoting really positive mental health. And I think that's a key thing for me because we all have mental health. I have mental health today. I'm talking to you, so I've got great mental health. I know when I meet you, we have good times, we have a laugh, but it's about that positive stuff, isn't it? It's about really living for it and understanding that we can promote positive mental health across the patch. And we do that through asking people to do physical exercise or going for walks and just being around and also opening up and talking. So they're the three elements. So it's basically reduce, prevent, and promote are the key elements, and that's a 3 to 5 year business plan. I always say 3 to 5 years because it could be completely useless in 3 years and we go. But if it stays, it's the 5 year plan to make the mind that I run the most successful but most impactful charity that I can run.
Good. It's very empowering. I really like it. It's and like you said, it is those walks, the talks. It's the more the sharing, the more the awareness,
Mm.
getting it off your chest. It just makes you feel better. And if you've got those avenues to speak to someone, it will only it will help that journey as in a positive way, 100%.
Absolutely.
So how has the conversation around mental health in the UK changed since you started? And what role has mind played in that?
Well, that's a great question. I think, well, firstly, let me say I'm as old as paper. So I think I've been around, but I think so I think when I was younger, mental health wasn't talked about, and the language was very different. And I think if you talk about, you can openly talk about mental health today in a wider public arena. You can use social media about it. You can talk about it. It's an accepted and understood part of people's lives now, and I think that's been real journey for us all. And I think that's the key. I think the introduction of when you look at the kind of how COVID affected people and especially young people in that basis, but also adults. How have we adapted that? And that also suddenly we had a lot more time to think about our own lives and the isolation or the friendships and the loss and the transitions and work and all that stuff. So we've actually openly really had a conversation. My thing is always that we should be more positive about the conversations and try and promote that prevention bit and reduction and promotion. But obviously mental health always has this kind of dark connotations over here, and I think we still see that a lot. Um, for conversations and where does mind sit, we have as if you know the system, there's a national mind. So it's kind of weird. We're part of a federation. We're of one of 100 different minds across the UK. National mind obviously do policy work, they do campaigning, do fundraising, they do a lot of really high level government policy stuff. So even in the HR world, you'll see that policy stuff that's been read. Mind will be part of that format and probably the legislative and all the stuff. They've been involved in that for that. What we do at local level is we listen to service users. I listen to my staff, my partners, my friends, how are we all getting on. We then feed that into the local system. So that could be, and when I say local system, I mean GPs, commissioners, hospitals, schools, the usual kind of group of people you'd expect to be in a kind of stakeholder environment. So I always look for when I capture people's lived experience, I like to use it. So you'll have this for people say, "Oh, we're engaging all these people." Engagement's really easy. We're engaging now. We're having a nice chat. It's about how do you get impact from that engagement, though? What have you learned, and how do you then change it? And we're lucky to have organisations like Healthwatch Southend, Healthwatch Essex, and other partners who will use that information. We do research as well, so we're working with Essex University. So we're using that information to then co-produce services for us, but also for other people. And I think that's the impact that you really want. You want that kind of lived experience, that voice on the street, but also you need the national one. You need the government to say, okay, we recognise that. I think the other thing, look, without being political, this is we're always asking for more money. Like, can we have more money? We need more money. We need more staff. I mean, like, that's never actually going to happen in whatever reality we're in. So we need to take control of it ourselves, be responsible. And a charity like Mind can actually be a really, really big player in that. We can really do an amazing piece of work.
Yeah,
So that's where we sit on that.
perfect. Thank you. How is Mind addressing the mental health crisis among young people and the underserved communities?
Yeah, that's well, they're the biggest challenges, I think, especially from COVID. Mind itself obviously recognizes that and they do the research and it comes down to local minds. So the Mind that I run, the charity I run, we run contracts where we work in schools. and we run with partners around offering counselling to young people. We're just starting to do some work around working with youth groups. And I think the key is to be openly talking to young people, and it's about where do you sit with them. Some of it is online. There's obviously a digital. This is where I show my age. The young people of today always say it's awful, but there's a real passion of mine about helping young people become really, really responsible adults and coming through and almost surviving this kind of period of their lives, but also enjoying it. And there's a way that we can work with partners around the digital stuff. So there's Coof Online. There's some really good Calm. There's some really good online apps that we can help them. We obviously support that as National Mind and Local Minds. But what we're looking to do is we're looking to do some more stuff around actually engaging young people. So, we got some projects where we're looking to just work with them wholly, and that would be really exciting. Minority groups and groups that are under that's really hard because it's one of those ones. So faith is a big thing in the areas I cover. So we're openly talking to faith groups, and that's of all faiths. So that's the nine main characteristic faiths. So my background is kind of in working in faith. So that's been a really good conversation about how does my mind work with their culture, their groups, their understanding of faith and mental health. That's a really good one. We're working with neurodiversity. So we're working with a lot of really good local charities around that. And again, they do amazing work. Well, or we're all, say all we're offering, or what we're offering is our expertise around mental health.
Yeah,
So between the two groups and working with them as a co-production, we're starting to get really good, tailored, specific services. The other area I think that's been a real one is around gender identity, sexuality, and stuff like that. So we're always looking to work with, other partners in that area. We might not be the perfect partner, but certainly we can refer. So I think the key is, if my answer is always, we're more on the ground than we ever were.
yeah,
So I spend a lot of time what I call working my shoe leather, where I just walk around. My charity is about, I always say to people, my charity is always a street fighting charity. And I mean it in the sense of I like to go, which street can I fix? How can I help that street itself in which that community work? And so we're very local, very local. And the idea is that we have place-based offer across my area where we're working in Rayleigh or Chelmsford or Hockley or Hawkwell, wherever it be. What is it they need? And we tailor that there. And I'm a real believer in this whole concept of asset-based community development. So I don't need to build a building there. I don't need to have a shiny mind building. I can go to, say, a local church, village hall, local office, and actually run a service from there. So again, that's a lot of on the ground partnership working. So yeah, we're just really, if I'm really honest, we're just listening the hell out of it. There you go. There's a quote.
like that. I like that. And that's it. It's listening to your community and making,
Hmm.
helping and supporting and making things better for that community. And it's yeah, that comes across. Um, what can individuals and businesses do better to support mental health in their communities?
Yeah, I think individually, I think we can all, especially if you're an adult, take responsibility. I always say the reason I go to the gym and I keep fit is because I never really want to go in the NHS system. It's not because I don't like it or trust it. It's just like I just want to keep out of it. I want to keep well, and that also helps my mental health. So I always say to individuals, it's partly down to you, and that's what can we do with you to do it. I'd always say engage with your local community.
Yeah,
Try and find something that you're interested in and find fair weathered friends, a bit like what we do on our courses. I think the other thing about it is try and it's that bit as always. It's about especially with social media. You hear the stuff about social media. People are really isolated and they get really affected and driven by what they see on social media. My thing is go out the door. Go out the door and go and meet the community that you're in. And that's easier said than done for some people, but just ask for help. So if it's a mental health thing, ring up Mind, email us. We'll see if we can help you. If it's a local thing around a local group, go and volunteer. So there's volunteer groups, there's SABs and RAVs and CAVs and Chelmsford CVS. So there's lots of opportunities. So as an individual, it's about me promoting to them, look after yourself and keep mental health. And when you need help, reach out.
yeah,
Don't sit and hide. And yeah, there's a lot of data around people, especially men are the worst, who don't reach out, do they? They don't talk, they don't want to see the GP. Do it early, get out there, and you'll be surprised by how much support you can get. The
mm,
corporates and businesses, I think the great thing about it is one is make sure you know your HR.
Yeah.
Make sure they get onto you, Eloise, and make sure they understand what the HR is so they don't get caught out and don't end up in tribunals. But if they do, yours is the phone number they need, isn't it? But the other thing is, and it's part of our corporate package, when I arrived, we work with three or four quite large companies at the moment, and I went along and spoke to them again, listened to what they wanted, and we've created a counselling offer. So whether members of staff need support, they can call us and they can get counselling support at a certain level within about 48 hours, which helps them. We offer training, obviously, volunteer days, well-being days. I think the key for businesses is about I want people to really enjoy working where they work and have good positive mental health about it. And if not, the company can then, in a nice sense, send them to us, and we can help and work with them, and we work with their families and stuff like that. So there's a big thing about that. I think for me with businesses is if you want people to be really productive at work,
Yeah.
look after them. And it's one of the things that I bring into any charity. So charities normally, when you go, they don't really set anything up. They tell you how you should do it, but they don't do it themselves. So one of the things we've got is we've got support for all members of staff, which is an external counsellor as well. So if I need support, I can go externally and get support. We do wellbeing days and we do training. So I think it's about what do you need to do. The other thing about corporate, and I would say this, is that I think there's volunteering days, fundraising days, builds a team ethos.
Yeah.
There's obviously, I work for a charity, we do a lot of fundraising, but it's also a really good promotional thing about corporate social responsibility. It's like that kind of that the mental health awareness is in October, and you can ask corporates to put up the blue balloons, talk to Mind, raise money for your local Mind, but also then have a conversation about it. And I think that's a great thing. And if anyone's any doubt, either give you a call, give me a call. But I think businesses, it's just been really hard for businesses. I
Yeah.
think there's so much, although we're a charity, we're actually a business with a charitable heart.
Hmm.
And I think the key is, even for me, with working with my staff team, you have to try and still keep them all going and make sure they're doing the job. And that's really hard because people think the charities, you shouldn't be businesslike. And, I am very businesslike. And I just think, no, I look after my staff, but I still expect the work done. So all the training, all the one-to-ones comes through. So yeah, there's a big part to play. And if I can do anything working with you, let me know.
Good. And I think it is, like you said, that a lot of companies are still not kind of moving forward with the modern days, are they? They're very much in that kind of demand control kind of
Yeah,
culture. And that comes down to normally generational thing, a managerial thing, people not understanding the way the world is moving more towards leadership, which is more natural and understanding the people development, investing in people. And a lot of companies are shifting that pattern to that
mm,
way. And what you are seeing is they are implementing mental health and wellbeing packages
yeah,
or have an internal wellbeing coach, etc. And they are moving forward with the times. And some of these companies are still kind of stuck in that generation of not wanting to change.
yeah,
Unfortunately, things do need to change, especially when coming to people. It's especially after COVID because it's kind of plummeted
yeah,
since then, hasn't it? And people are talking more about it. And I know you talk about like male people don't like to talk about it, but the more awareness we can make, the more natural it becomes,
yeah.
and more shift in that pattern happens, and it's just a positive then. And I totally agree with you there. Okay, so are there any new initiatives or partnerships you're particularly excited about, Mind?
Yeah, so one of the ones that we've really looked at. So you asked earlier about children and young people. We've got some funding from National Mind to deliver a CrossFit young people's
Oh,
mental health project. So we're going to be working with 60 young people over the next 12 months with a local partner, and that's really exciting because you get a lot of walk and talk and we were approached by a local CrossFit company, and the guy there had a really amazing lived experience story, and it was always working in schools, and said, what can I do more? And we said, well, look, let's put a bid together, and we'll put it together. So we've got these 60 young people about to sign up to do CrossFit, and of course I can't do CrossFit, but well, it'll be really exciting for them. I think that's a massive thing, and again, I think there's good role models in that as well. So we're doing the mental health side to it and counselling and stuff. We have a project we're really hoping to get off the ground, which is working with people who've survived breast cancer. And again, it's not replacing anything else, but it's about how we're running a course with a local training person about how to re-engage with life and society and work after that, and also how to cope, still keep going having had that trauma, and when we're putting the mental health stuff into that as well. And I think that if that comes off, that'd be great for us because I really have part of my experience has been working with long-term conditions, and I think people they just assume that if it's Parkinson's UK will do it all. Well, actually, they can't do it all. And what can we offer as a local mind? And we have space in that. So we're looking at long-term conditions. So that's a good project. And the last one, which I'm really, really pleased about, and I think it kind of touches on how you lead and how you manage people. When I arrived, I asked all my senior managers, okay, two questions, what do you do for job, and how are we going to help more people next year? That was my question. How are we going to double the amount of people we help? And the housing team were like, well, what we want to do, we want to get new properties, and we want to do this, and this. And I've basically let them breathe and just do the job. And we've got a new place that we're taking on called Century House. That's got 6 new flats. And I have an office space, a counselling space. It means we help 6 more people, but also it means we have a new space, a new venue to do counselling from, and that's 7 days a week, which is even better. So that really felt really positive, and I'm really excited about that because again, it's a real asset-based community, place-based piece of work, which again is what I wrote in the business plan. It's kind of weird. It's like, will the business plan actually work? Well, actually, within about I think actually they were doing that before I even finished writing the business plan. So it's really exciting. And then we're still just working with partners, and I think that's the one thing I love when I come to charities. It's about opening up the doors and saying, what do you do? How can we fill these gaps? What are we listening to? So yeah, I'm really excited. It's exciting times for us, and I think I've spoken before. I think if you become a charity, it's like a business at any level if you are really passionate and really committed and you're doing exciting stuff, you then start to you become a magnet for people. And we've just been out recently looking for some new trustees, and it was because trustees were stepping down. They'd done their time, and I was like, oh, okay, well, thanks very much and goodbye. But you look at that, we needed 4 roles filling, and we've had just the most amazing response from the most amazingly talented people. So and it's I'm sitting here now thinking, well, I can feel those, but what about these other people? They're so good. So we're now looking at a stakeholder group to support the board and support me because of their expertise. And I think that just shows the value of the mind that I run, the work that we do, but also the commitment to the people of the area and mental health. And I think there's a beautiful thing when you can get people on the board or volunteers to say, through your work, we will save lives.
Yeah,
And there's not many people can say that in their jobs, but I'm really pleased to say that if you work with my charity, that's what you do.
love that. Okay, so what's the last question for you? And then you're
Okay.
allowed to go. What would be the most meaningful moment you've had during your time at Mind?
Yeah, that's a really great question as well, isn't it? I
Pretty
would
well,
say. Yeah, well, I think that meaningful moments were one, obviously meeting you and other like-minded people. That's been wonderful. It's been a joy. I think just in a nice sense, I always like meeting clients. Like I say, I'm always the guy behind the scenes. I'm
yeah,
I'm not although you have to be sometimes the front of house. I am. Like I said earlier, I'm the least important person. The people who work with this shit. So when I go to the properties that we own and I meet the clients
yeah,
I just sit there and have a cup of tea with them and a coffee, and I find that they tell me their stories. I'm always genuinely taken aback when people just share with me openly that they're either struggling or they've had this happen in their lives, and I take that as a really good sign that I'm clearly somebody I can talk to.
true.
I think business wise, always it's having Century House, having new ideas, new people investing in us, trustees coming to us, but. I think the most meaningful thing is that you feel like you're making a change.
Yeah.
I've come to a charity and it's kind of like a turnaround, but it's not really. It's like just reboosting it, refreshing it, giving it a new idea. So yeah, hopefully I'm making a bit of a difference.
Oh, you're
Yeah,
a
yeah,
major positive impact, David. You're just such a wonderful guy. Your heart's in the right place, and yeah, you're gonna absolutely smash it. You got to take my hat off to you and believe in yourself because you're amazing.
that's very kind.
That is all your questions done today.
Ah, wonderful. Thank you.
No,
As
that's
ever.
okay. So it was an absolute pleasure to meet you, and thank you so much for your time today. If anyone wants to get in contact with you, what's the best way of contacting yourself, David?
So if they want to, so if they're not in the Essex area, so they can go to National Mind and go on to, there's a link map, just put your postcode in, that'll tell you the closest mind. If you just Google Southeast Essex and Central Essex Mind, will come up. And if you just go through the website or give us a call, whatever's easiest for you. If you want to refer, you can do that through the website. And if you want to call, just call. And if it's you know, work with Mind, yeah, just click on the Mind link.
Perfect. Brilliant. Well, thank you so much for your time today. It's been an absolute pleasure speaking to you, and have a wonderful rest of your day.
Yeah, thanks a lot. Take care.
Bye bye.
Bye.